Hi everyone, I'm Dr. Charlotte Hodges. I'm a board certified surgeon who's been practicing in Dallas-Fort Worth since 2011, and I'm specializing primarily in bariatric surgery. I offer both surgery and medical weight loss options in my practice. Today I wanted to talk a little bit about who is actually a good candidate for surgery, and I really want to dispel a lot of myths surrounding surgery. There's a lot of good information out there, but there's a lot of misinformation. And what today is about is clarifying things for people. I think we all know someone who has had a struggle with their weight, whether they have 20 pounds to lose, 50 pounds to lose, or more than 100 pounds to lose. This can be a lifelong journey for many patients, and certainly for my patient population that will come to see me. Surgery is not their very first step or their very first choice in an effort to reach their weight loss goals. When I have a patient that comes to see me, they've generally tried Jenny Craig and Weight Watchers and keto diet. They've done the grapefruit diet. They've juiced. They've had bone broth. They've done everything under the sun. Oftentimes, they've even tried many different weight loss medicines, whether they ordered it late at night off of an infomercial or they've gotten it from their primary care doctor, and they're just not meeting their weight loss goals. So if you are a patient that has had a struggle with their weight, or if you're a patient and you have high blood pressure, diabetes, sleep apnea, PCOS, you're struggling with infertility, these are all things that can be remedied and actually taken care of if you undergo weight loss surgery. Bariatric surgery is way more than just losing weight. And what everybody really needs to know is that, number one, it's not a magic bullet. Number two, it's an effective tool for weight loss, not just for immediate weight loss, but for longevity of weight loss. And number three, it is not an easy way out. When I have patients that will come to see me, oftentimes they're a little nervous, they're frustrated, they may or may not have a lot of support from their family and friends, and many times they just feel like a failure because they have not been able to get to where they want to be. Either they've struggled with their weight all their life, or maybe they were fit previously and now just over time they've gained weight and they just aren't finding a way out of this troublesome mess that they've gotten into. What I want patients to know is that you're not alone. Surgery is a wonderful, wonderful way for you to be able to reach your weight loss goals. And it's not easy. I think that's the very most important thing that people need to know. It is not the easy way out. If someone is undergoing surgery, they're going to need to recover from that surgery, and they're always going to need to do the things that they need to do to make sure that that surgery is a success. That's going to be taking their vitamins on a regular basis, always incorporating protein into their diet, and really making sure that in the long run, they're always making healthy choices. Like I said earlier, these surgeries, they are just a tool. They're a very powerful tool, and actually for some disease processes, it's the only tool that can get these disease processes to go into remission. So I think another thing that people kind of have a misconception about when they're thinking about surgery is it safe? And what's nice to know is, yes, surgery is incredibly safe. Many times I'll have a patient that will come to see me and their sister's best friend's uncle who had their hair cut last week said that they knew someone that had a really bad outcome from weight loss surgery. And I have to tell you, with any surgery that you undergo, regardless of what that surgery is, there are going to be risks related to that surgery. But what I can tell you is with weight loss surgery, when it's performed laparoscopically by a competent surgeon, you're going to have some good outcomes. Typically, what you'll see is you have a risk of about 5% for bleeding and infection. There's a less than 1% risk for a staple line to come apart, and there's a less than 0.05% risk for mortality. I just got back from a conference in February. It was an international bariatric conference, and we now have data that shows that it's actually safer to undergo laparoscopic bariatric surgery than to undergo having laparoscopic gallbladder removal. That's huge, because how many people do you know that have had their gallbladder taken out? So if anybody out there is concerned that maybe surgery is unsafe, that's simply not true. Surgery and weight loss surgery is actually a very safe surgery to undergo. And I think finally, is surgery something that is available to anyone and everyone? So meaning, if you've had a previous weight loss surgery, can you undergo surgery again? And the answer is yes. If you've had a previous band, if you've had a previous sleeve gastrectomy, previous gastric bypass, if you've had a melena band, VBG, stomach stapling, was maybe your surgery performed open and not laparoscopic? Are you out of luck, or can you undergo a revision surgery? And for me, the answer is yes. You can absolutely undergo a good, safe laparoscopic surgery that's going to give you good outcomes with low surgical risks. So I hope that everybody out there now has a little bit better idea about what weight loss surgery can do for you, that it's a very good, effective tool. Patients can lose anywhere from 65% to 85% of their excess weight. That means they can lose 65 pounds to 85 pounds for every 100 pounds that they're overweight. For some surgeries, there's little to no risk for weight regain. You can have resolution of your health problems such as high blood pressure, diabetes, PCOS, sleep apnea. It can even help you if you have issues with infertility. These are good, safe surgeries. They have low risks. And finally, if you've had a previous revision, if you've had a previous weight loss surgery, you can certainly undergo a revision surgery. So if you have been struggling with your weight, if you have 50, 60, or maybe even more weight to lose, if you have different health problems and you've been struggling with these, or if you're having complications from a previous revision, bariatric surgery just may be right for you. I hope that this has helped clear up some of the myths. If you like this information, give me a thumbs up and don't forget to subscribe.